New videos every day.
Hi, I'm Radhia Gleis. I'm a certified clinical nutritionist, and I'm at Austin Integrative Medicine here in Austin, Texas. Now, some people are confused about certified clinical nutritionist, or CCN, versus a dietitian versus a clinical nutritionist versus a nutritional counselor versus a naturopath, and there's all kinds of various different practices out there, and they all have a different scope of practice, and they all have different education backgrounds and educational focuses. So I want to tell you a little bit today about what a certified clinical nutritionist is and what it takes to become a certified clinical nutritionist. We call them CCNs. In order to become a CCN, first of all, I'll tell you what the educational background is. It is mandatory for a CCN to first have a minimum of a bachelor's degree in nutrition from an accredited university. And then it is also mandatory for a CCN to, above their degree, they must take a postgraduate course in clinical nutrition and biochemistry. Most of the CCNs are it is important for them to have an emphasis on biochemistry, and I'll tell you about that in a second. Then a CCN is required to do 900 clinical hours in residency before they can sit for the exam. Then once they sit for the exam, they're certified by the CNCB, which is the Clinical Nutrition Certification Board, and they receive their CCN, or the title of CCN. Now, the importance that I think a CCN is in the community is that we sort of bridge the gap between the medical paradigm and the alternative paradigm. We are trained much more in biochemical assessment and taking a biochemical approach by looking at blood chemistry, looking at neurochemistry, looking at various different analyses. It may be stool analysis or urine analysis. And so we have a big emphasis on using the tools of conventional medicine. And even some of these tools, a lot of conventional medicine isn't even aware of, but there's some very good tools out there. And then our job is to analyze them, not to look for pathology per se. In other words, we're not looking for disease. We're looking for imbalances that could lead to disease. Now, certainly we are also trained to recognize in those chemistries if disease is present, and then we, discuss strategies of how to not only support your body, but how to work with perhaps your medical doctor or another licensed practitioner. We do various things from once we analyze what your biochemistry is and can pinpoint where the imbalances are, then our job is to help you with diet and supplementation to bring that body back into balance. And it just depends on the individual. For me, I'm a holistic practitioner, so I also have an emphasis on body, mind, and spirit, because to us, and most CCNs are trained this way, we look at the whole body, so you can also put us in the category of a holistic practitioner. We consider that the body, mind, and the spirit all are interwoven, and you really can't separate them out. We use these tools. For example, I am trained to read your blood chemistry, but from a different perspective than, say, a medical doctor. Again, a medical doctor is looking at reference ranges coming from that lab. And understand, when you go to your doctor and he comes back with your blood report, he is looking at reference ranges, and if you're out of that range, you're in pathology. Be aware that these ranges are pretty much, they're created in the labs. So you may go to LabCorp, or you may go to ClinPath, or you may go to whatever lab, Quest Lab, etc., that your doctor sends you to. And those labs have their database of patients. And so they set those they set those ranges according to the patients that come in. Now, so bear in mind, most of the patients that are coming in are either coming from doctor's offices or hospitals. So really that range is a range of sick people. And we know that when you look and you're out of range in there, then there's some pathology going on. The clinical nutritionist, the certified clinical nutritionist, is trained to look outside of those ranges in a parameter that is about 10 degrees in either direction. And we're also trained to look at the various chemistry in relationship to each range or each set of numbers. This tells us or gives us clues or hints of what's happening with you biochemically that, if not corrected, eventually will become a disease state. Most people don't realize that, you wait usually until the horse is out of the barn before you do something about it. You wait until there's symptoms, and on a scale from 0 to 100, 100 being absolute perfect health and 0 being death, we don't start to really experience symptoms until we're at about 30. So 60% of the vital energy of the body is diminished, and then all of a sudden the body's knocking on the door saying there's something seriously wrong. At that point, pathology has set in or disease has set in, and the horse is already out of the barn, and then you may have to be subjected to the medical modalities such as drugs or surgery, etc. So our job is to sort of go beyond that and sort of catch you when you are in a biochemical imbalance and restore that balance before disease and symptoms starts to manifest. Now, of course, realize that symptoms are a knock on the door, and even the slightest symptom, fatigue, headache, nausea or burping or belching or not good bowel function or other things, skin manifestations. These are all little hints that there's something imbalanced. We don't like to put a label on them per se and call them a disease or a condition. We want to read the body from a different position. A mentor of mine once said to me, "Remember, Radhia, that the body doesn't make mistakes, and that everything that's coming out of that chemistry is a hint that there's something going on." So we take a different approach. For example, if your cholesterol is out of balance, we ask the question, why is the cholesterol out of balance? We don't look for the immediate thing to try and give you, such as a medication that the doctor would give you or something to reduce that cholesterol. We're looking at asking the question, what is our body trying to say to us? Very often cholesterol may be out of balance if the body is got a toxic load. The body stores toxins in fat, and it also will build a fatty layer to protect toxins from getting into the blood-brain barrier. So oftentimes, if you see an elevated cholesterol, you may be very toxic. So a certified clinical nutritionist is also trained in working with detoxification and working with lifestyle changes and diet changes to start to bring that cholesterol down from a more natural approach. So this is basically what a CCN does. A dietitian, on the other hand, a dietitian is trained mostly in food services. You'll see a dietitian's places generally in hospitals, in the school system, in prisons, and in large institutions. They are generally, unless they have advanced training in clinical nutrition, they are not trained to do what a certified clinical nutritionist does. They also are not trained to use certain tools such as supplementation, which we do, dietary supplementation. We're trained across the board in homeopathy, in herbology, in vitamin, mineral nutrition, and what we call phytonutrients or just more advanced concentrated nutrients to help restore the body into balance. So that's what a CCN is. That's what I do, and I do hope that you'll come visit me if you're in the Austin area. I'm at Austin Integrative Medicine. You can visit my website, which is www.advancedhealthinstitute.com, or my clinic's website, which is A.I.A.A.C.N. This is Austin Integrative Medicine, AIMMD.com. And please visit me. We welcome your comments. We welcome you to rate this program, so please do. I'm going to be doing a lot more. And we also invite you, if you have not, to subscribe. So make sure that you push that yellow button next to you and subscribe. We would love to hear from you.